Hey, Mrs. Jason, how you doing? I'm Berto. I'll be your student nurse for the day. Close the curtain. Can you give me your name and date of birth? All right, all matches. Awesome. Do you have any allergies that I should know about? No? Are you in any pain today?
Yes.
What kind of pain are you having?
Stabbing.
All right. Can you give me the area?
My leg.
All right. On a scale of 0 to 10, 0 being no pain, 10 being the highest, can you give me a number?
7.
All right. So I got your medications here for you. I was wondering, do you need anything for pain?
Yes.
All right. I got some medications here for you. All right. So I'm going to check these medications with your doctor before I administer them, okay? So, ring. Hey, Dr. Smith. This is Humberto Cervantes, RN on the ortho floor. Is this Dr. Smith I'm talking to?
That is correct.
All right. I'm taking care of your patient, Mrs. Jacobson. Is this your patient?
Yes, she is.
All right. Well, she has no known allergies. She's having hip replacement surgery tomorrow evening. Her vitals are normal. She's complaining about some pain. I was just calling to verify and check up on some orders that you had given. She has an order for 30 milligrams of enoxaparin subcutaneous injection now and every 12 hours until surgery. The recommended dose is 40 milligrams of enoxaparin given subcutaneously 12 hours before surgery and to continue 40 milligrams subcutaneously daily for up to 3 weeks. Would you like me to give the recommended dosage, time, and frequency?
Yes, I think that'll be okay.
All right, so I'll read that back to you. You want me to give 40 milligrams of enoxaparin subcutaneously 12 hours before surgery and to continue with 40 milligrams subcutaneously for up to 3 weeks?
Correct.
All right. She also has an order for 12.5 milligrams of hydrochlorothiazide given orally daily with at least 1 hour before a meal. The order does not specify the form of the drug given, and we only have hydrochlorothiazide in 25 milligram tablets in the Pyxis. It also states that you want to give it at least 1 hour before a meal. It is recommended to give with food to minimize GI upset. Would you like me to give the form we have and with a meal?
Yeah, that'll be good.
All right. I'll read that back to you. You want me to give 12.5 milligrams of hydrochlorothiazide tablets orally daily with a meal. And lastly, she has an order for 5 milligrams of morphine sulfate given intramuscularly PRN. The order does not specify frequency. The recommended frequency is 4 hours PRN. Also, giving morphine IM might cause a hematoma because we are also given enoxaparin subcutaneously. Would you like me to still give it Would you like me to still give the injection with the recommended frequency still?
Yeah, I think it'll be okay.
Okay. All right. I'll read that back to you. You want me to give 5 milligrams of morphine through intramuscular injection every 4 hours PRN and monitor for any hematomas?
Correct.
All right. Are there any other orders you want me to implement?
Nope. I think that'll be all good.
All right. Thank you. Have a nice day. All right, Mr. Jason, like I said, I have all your medications right here in front of me. First, we are going to give enoxaparin 40 milligrams subcutaneously. This is an anticoagulant to prevent blood clots before, during, and after surgery. I'll be administering it in your left deltoid, which is your left shoulder. We'll be administering this cautiously because you're an elderly patient and you are at risk of hemorrhaging or developing a hematoma. You might experience some nausea or a headache as a side effect. Let me know if you notice any excessive bleeding, and it might sting a little bit when I'm injecting it. So, form hand hygiene again. Gloves. So, enoxaparin, we have 100 milligrams per milliliter solution. So I would be administering 40 milligrams, which would be 0.4 milliliters, 0.4 milliliters. So first off, I would clean the deltoid area, going from a circular motion out. Throw that away. Let that draw off. Do not blow on it because it could cause contamination. Open my sharp box. Want to get it?
Yeah.
Okay. pull out my syringe, check if it's the right needle. I also need to check if the enoxaparin is, expired, which it is not. Also, I need to check my MAR to make sure this is the right patient, which it is. Mrs. Jacobson, everything's correct. Dosage and everything's correct. So that'd be the third check I've already done for the right medication, right patient, and right dosage and right route. Since it is a new top, I don't need to clean the top. Like I said, I need 0.4 milliliters of enoxaparin. As you can see here, I have 4 milliliters of enoxaparin. I can't really tell. Okay. Once it is dry, retract the skin, enter at a 45-degree angle, and dart it. And measure slowly. Use any gauze if needed. Throw it in the sharps container safely. Alright. So you said you were having some pain?
Yes.
Alright. Can you give me a number on the pain, 0 being no pain, 10 being the worst pain possible?
About a 7.
Alright. Would you like something for pain?
Yes, please.
Awesome. Then I got some morphine for you. So this is going to be 5 milligrams of morphine intramuscularly. This is a medication used to treat pain. It is available every 4 hours if you need it. PRN. I would assess your respirations and check your blood pressure before administering, because one of the side effects of morphine is slowed respirations. And also another side effect is constipation. So I would not give with caution of the morphine if it was darker than pale yellow, discolored, or had precipitants, if the patient had respirations under 10 minutes, or if the patient was taking other CNS depressants, which you're not. Another side effect might be nausea, so let me know if you experience any of that, or any drowsiness or difficulty breathing, because that could be a sign of over-medication. Alright. So I'm going to administer this in your right deltoid, since we already used your left. Like I said, I would check my MAR with the patient again to make sure I have the right medication. Check my armband, make sure it's the right patient. So clean the circular motion going out. Dispose of that. So my solution is morphine with 10 milligrams per milliliter. So I need 5 milligrams. So I'd be drawing out half a milliliter. So I'd be drawing out half a milliliter. So I would take 5 milliliters of air, inject into the solution, and draw 5 more, and then I'm ready to draw out the solution. half a milliliter of morphine. No bubbles are present. Alright, that's half a milliliter of morphine. Okay. Now, since this is an intramuscular injection, I would give it a 90-degree angle. Dart it. Slowly inject it. Discard it in the sharps container. And use any gauze if needed. Alright. My gloves. So the last medication I have for you is hydrochlorothiazide, which is an antidiuretic used in hygiene. It's used to treat edema, which might occur after your surgery. And we only had 25 milligram tablets, so because we don't have a score here, in a real hospital setting, I would score this tablet since it's 25 milligrams, and we only need 12.5 milligrams. So before I would administer this medication, I would assess her blood pressure. I'd check her weight and check her eyes and nose because it is a diuretic. I would not give if the patient had any allergies to thiazides. I would administer this cautiously because I have an elderly patient and fluid volume deficit is possible. Side effects are dizziness, hypotension, and hypokalemia. So I advise you not to change positions too fast because it might cause dizziness from the orthostatic hypotension. Would you like any water or juice with that?
Yes, please.
All right. So I have a cup of water. I have a medication right here. I'd squirt. Half in there. And then when I check it with my MAR is the third check, so that'd be my third check with the medication. Have the patient take the medication. Here's the water. All right. Throw all my materials away. All right, Mrs. Jacobson, is there anything else I can get you right now? No, that's good. All right, I'll be checking up with you in a couple of minutes or about 15 minutes to make sure you're doing all right. Let me know if you notice any of those symptoms or side effects that I told you about, okay? All right. Provide or take off curtain, do hand hygiene, and then walk out.